Good afternoon, everyone. Thank you for joining us today. I'll start with the usual update on the most recent COVID statistics. I can report that an additional 3 positive cases were confirmed yesterday, which takes the total to 18,368. A total of 616 patients are currently in hospital with the virus either confirmed or suspected. Now that's 67 more than yesterday overall, but it includes a reduction of 8 in the number of confirmed cases. A total of 12 people last night were in intensive care with confirmed or suspected COVID. That is 6 more than yesterday, but the increase is all in suspected cases. Indeed, as of now, although these things are always subject to change, but as of now, there are only 2 patients in ICU in the whole of Scotland with confirmed COVID. Since 5th March, a total of 4,131 patients who had tested positive and required hospital treatment have now been able to leave hospital. And I am very pleased to say that during the past 24 hours, no deaths were registered of a patient confirmed through a test as having COVID. The total number of deaths under this measure, therefore, remains at 2,490. And it's worth just noting that today is the 6th day in a row in which 0 deaths have been registered. And it's also the first Monday with no deaths registered since the 10th of March, which, as you know, is before lockdown started. Tomorrow, of course, National Records of Scotland will publish their weekly report on COVID deaths, which uses a broader measurement than our daily figures. And the other point I want to make, as I always do, is that even as the daily numbers of COVID deaths decline to very low levels, it is still really important that all of us remember the overall impact that this illness has had. And my thoughts again are with everyone who is grieving the loss of a loved one. In addition, I also want to thank again our health and care workers. The entire country is extremely grateful to you for everything you do. And today, let me be very clear that that includes the care home staff who do us the honour of coming to Scotland from overseas to work here, including the 6 to 8% of our care home workers who come from other countries within the European Union. In my view, it is essential that care home workers are included in any scheme for post-Brexit work visas. The Scottish Government will continue to make strong representations on that point to the UK Government. I also want today to pay tribute to staff in our local authorities across the country. During this pandemic, council workers have continued to deliver essential services in very challenging circumstances. But they've also worked closely with Scottish Government on vital issues such as housing homeless people, paying business grants, providing education hubs and much, much more. In doing that, they have protected vulnerable people and provided help for those who need it. That effort has been and continues to be hugely appreciated. The Health Secretary will speak in a few minutes about our new Right Care, Right Place campaign, which encourages you to get help and treatment from the most suitable source. That could be from the NHS Inform website, your community pharmacy, your GP, a minor injuries unit or accident and emergency. The Chief Nursing Officer will then say a word or two further about face coverings. Before then, though, I have 2 issues I want to update you on. As you know, tomorrow sees a further reopening or resumption of many important services. In fact, tomorrow marks the biggest step so far in our exit from lockdown, and I will come back to say a word more about that at the end of my remarks. But from tomorrow, the tourism sector can reopen, as can venues such as museums, galleries and cinemas. Indoor hospitality can start up again, hairdressing services resume, faith services can restart, and the childcare sector will be fully open once again. The Scottish Government is publishing today 2 new pieces of guidance, both of which can be found on our website and both of which are directly linked to these changes. We have firstly published guidance for places of worship, which provides information on how places of worship can ensure the safe resumption of congregational services. The guidance provides detailed information on issues like physical distancing, cleaning and the maximum group size of 50, which we are currently permitting for services. Now, I know that the resumption of communal prayer and worship is something that has been long awaited by people of all faiths. Today's guidance will, I hope, be useful in enabling such services to take place as safely as possible from tomorrow. The second piece of guidance, which is relevant to places of worship as well as to many other venues, gives advice to businesses and organisations about the collection and retention of customer, visitor and staff data. The guidance applies to all sectors where there could well be a high level of interaction between people who do not know each other. And that could be through close contact between staff and customers, like at a hairdresser's, or because a relatively large number of people are in a relatively confined space for a long period, such as restaurants, bars, or other settings, including, as I say, places of worship. The guidance covers a range of issues. For example, it makes clear that employers should save staff rotas and have up-to-date contact details for employees. They should also ensure that their booking systems and ticketing methods allow contact tracers to locate and notify customers. Now, it's maybe worth stressing that data collection is not, and it cannot ever be, a replacement for other safety measures. Other precautions will continue to be vital, such as physical distancing, ensuring good ventilation and airflow, and wearing face coverings if physical distancing is more difficult. But data collection is very important. It means that customers or staff can be notified if they come into contact with somebody who is subsequently found to have COVID. It's therefore absolutely crucial to our test and protect system. And it's one of the measures that we hope will help to build public and staff confidence as more premises reopen. So I would encourage all businesses to read today's guidance and to consider very carefully whether their plans follow these recommendations. And I would make a plea to all customers to accept that if you want to go somewhere like a hairdresser or a place of worship or to a pub or a restaurant, you will be asked to provide contact details. You should cooperate with anyone who is asking you to do that. In fact, if you're not prepared to provide your contact details, my message to you is pretty blunt. Don't go to these places because you could be putting others at greater risk. Today's guidance is in the best interests of businesses and the public overall. And all of us, as has been the case throughout this crisis, have a shared interest in making it work effectively. Because of that, the guidance on data collection is a good example of the wider point that I make here regularly. As we get out and about a bit more, there are some new constraints or responsibilities that all of us as individuals have to accept for all of us as society to enjoy a less restricted lifestyle. Wearing face masks as shops open up and public transport services get a bit busier is an example of that. So too is providing your contact details as indoor hospitality and other services reopen. Measures such as these will allow us to interact a bit more with each other while still protecting ourselves and each other. So please follow these rules. And remember more generally that sticking to the public health advice is not less important now, it's more important now as we open up more services. More important indeed than it has been at any point previously in the crisis. And I really can't stress that enough. To be very blunt with you again, the changes that come into force tomorrow are the highest risk changes so far since we started to come out of lockdown, because many of them involve indoor activity, and we know that the risk of the virus spreading indoors, in a pub for example, is significantly higher than outdoors. We also see that in some other parts of the world, these kinds of places are already being shut down all over again because transmission has increased. Just last night, for example, the state of California closed all of its bars, restaurants, cinemas and museums all over again. Now, we here in Scotland have been perhaps more cautious in the timing of some of these changes than some other places. We've waited until infection levels are very low before opening up these kinds of places. But that doesn't remove the risk. And I want to, just before I end today, be very clear what our immediate risk is so that we can all play our part in avoiding it. You might be hearing in the media today warnings about the possible scale of a second wave of COVID. And I can assure you that that is a risk we take very seriously, and we absolutely must do everything we can to mitigate against it. But our most immediate risk is not a second wave of COVID, it's a resurgence of the first wave. It's taken 4 painful months, but it is lockdown that has allowed us to stop the first wave in its tracks. By putting ourselves in lockdown, we also put the virus in lockdown. But I ask you to remember this: as we release ourselves from lockdown, we also release the virus from it. And so we have to work in other ways to keep it under control. And that means all of us, every single one of us, sticking rigidly to the rules. And that's why, and this will be the point, as always, that I end on, we keep stressing the public health campaign, the fact that we are asking everybody not just to remember, but to live our lives by. Face coverings in all enclosed spaces, shops and public transport, mandatory, but anywhere that physical distancing is more difficult, you should wear a face covering. Avoid crowded places, whether they are indoors or outdoors. Clean your hands and clean hard surfaces regularly and rigorously. Keep 2 metre distance, that remains the general rule. And self-isolate and book a test if you have symptoms. And you know that you can go to the NHS Inform website to book a test, and those symptoms are a fever, a new cough and a loss of or change in your sense of taste or smell. If you have any of these symptoms, err on the side of caution. Don't wait to see if you feel better. Go and book a test immediately and self-isolate immediately. If all of us stick to these 5 basic measures, then we don't eradicate the risk completely, because with a virus that is not possible, but we will minimise the risk of this virus getting out of control again as we take this next, so far biggest and highest risk step out of lockdown. So I appeal to you for your continued cooperation in all of that. My thanks to you, as always, for your cooperation, and my thanks to you for listening. I'll hand over now to the Health Secretary and then the Chief Nursing Officer, and we will then go, as usual, to questions. Jeane.
Thank you very much, First Minister. Throughout the first phase of the pandemic, you have followed our guidance very closely, and when you needed medical care, you've used your local pharmacy, your GP, your local minor injuries unit, or you called NHS 24 for advice and help. By doing that, you got the right care that you needed in the right place. And you also helped us keep our A&E departments free and ready to deal quickly with all of those who needed urgent care by our emergency specialists. As we move through this phase, easing lockdown measures and safely and steadily restarting our NHS, we need you to keep doing that, getting the right care in the right place. The NHS is there for you, but we don't all need to go to A&E, and for many of us, that isn't the right place. So today, we're launching a campaign to make sure that you get all the information you need to keep on doing what you have been doing. Sometimes self-help is the quickest way to resolve our health problems, and the NHS Inform website, which has proved popular in the recent months and proved very helpful, provides advice on common symptoms and guidance where we can help ourselves. Going to your local community pharmacy for their expert help in treating minor illnesses such as coughs or earaches, along with common clinical conditions such as urinary tract infections. Using your minor injuries unit for the non-life-threatening but painful injuries any one of us could sustain, the deep cut or the broken or sprained ankle or the painful burn. Contacting and using your local GP practice during the day for an appointment or for advice over the phone. And using NHS 24 and our out-of-hours services when you are too ill to wait for your GP practice to open for the clinical advice and help that you need. All of that closer to home and often with no waiting time at all. Of course, in an emergency, you should always call 999 or go to your nearest A&E. But if we all keep doing what we have been doing, we're helping those emergency doctors and nurses in the A&E give you or your loved one or a neighbour or a colleague the fastest and often life-saving care when it's really needed. As we restart our NHS, all of us can help make it work to the very best that it can. All of us can play our part by getting the right care in the right place.
Thanks, Jeane. And
Thank you. This afternoon, I would like to concentrate on the importance of face coverings, both in terms of protecting yourself and other people, but also ways that make that more efficient and more effective. I think, firstly, a huge thank you to everyone who's embraced wearing face coverings. Over the weekend, I was incredibly impressed when I was in the supermarket to buy food at everybody who was wearing face coverings, which was quite a stark contrast to perhaps the week before. So making sure that you wear your face covering properly is important, and a bit of thinking ahead and planning ahead is what we're all now needing to do. I've heard many people say, actually, wearing the face covering, I understand, it protects other people, but perhaps not myself. Well, what has happened is that the scientific advice is changing, and whilst at one stage it was thought wearing a face covering with people with symptoms had no relevance, now we are seeing evidence that it protects other people, and I do think we have a responsibility to protect other people. But there's also evidence that it protects ourselves. So there is no doubt in crowded places, and obviously in shops and in public transport, wearing a face covering is absolutely the right thing to do to make sure we all stay safe. But to do that does require a bit of thinking ahead and planning ahead. And when people talk about wearing face coverings, they talk about it's quite uncomfortable, it's quite warm. Well, what I would say is think of the doctors and nurses and others who are currently working in our intensive care units for perhaps up to 12 hours of their shift, who have to wear their PPE, including face masks, all of the time. So when we go into the shop and have to wear our face covering, it's only for a short period of time, and I think it's a small sacrifice if it is uncomfortable for people to deal with the heat of wearing the face covering, then I think it's absolutely one worth taking. But there are a couple of things that I think is important in terms of what makes it effective. Always, as far as you can, and that's why thinking ahead is important, if you have hand gel, apply that before you put on your mask, ear to ear, to make sure that you stay away from touching your nose and your mouth. But in particular, please make sure your face covering covers your nose and covers your mouth. Some people will pull it down so that their nose peeks out, and others will then pull it down under their chin. That negates the benefit of wearing the face covering. So please make sure when you wear it, you do wear it safely, you do wear it appropriately. Disposal is also important. We don't want the disposable face coverings to end up in our oceans and on our beaches. So please make sure you have the wherewithal to dispose of it, not crumpling it up, but either putting it in a polythene bag to take home and put in the bin, or put straightforwardly in a bin. And again, washing your hands or using hand gel after you've done that. And if we all follow these small rules, then we will all get the benefit of continued suppression. Some people who have a hearing impairment or who need to lip read may not be aware that you're talking to them in these situations. So please be patient with everyone when we're wearing our face coverings out in areas that there are more people, because as the First Minister says, if it's crowded, please don't go there. Face mask doesn't protect against everything. Making sure if you have symptoms, stay at home. 2-metre rule, stay away from people. In particular, when you're in shops, please be respectful of our essential shop workers and make sure that you give them space to do their job well. And of course, that hand hygiene and making sure that you're always washing your hands, using the hand gel, and when you go home, then making sure that everything is cleaned and dusted down properly. Thank you.
Thank you very much, Fiona. We'll now go straight to questions. Glenn Campbell from the BBC.
First Minister, what impact will the decision to exclude social care workers from the new UK health and care visa have in Scotland? And what will you do to make care a more attractive career option for the homegrown workforce?
In terms of the impact, I think potentially it will have a devastating impact on the social care workforce. I used a statistic in my opening remarks that is true for the whole of Scotland, that between 6% and 8% of our care home workers, social care workers in Scotland right now are from countries elsewhere in the European Union. That's a Scotland-wide figure. There will be some parts of the country where that is even higher. And the fact that social care workers will not be eligible for the health and care visa in future could have that devastating impact on the workforce. I also think, that aside, I think particularly now, I mean, I would be making this case at any time, but particularly now when we owe so much to our social care workforce, to exclude them from this visa risks sending a message that we're not grateful for the contribution that they have made, those who work in our social care system that come from elsewhere. So for the practical reason and the message it sends, I think it's the wrong decision, and I will continue to make very strong representations to the UK government to change that. We will be thinking very hard about, not just for our social care workforce, but our healthcare workforce, how we make sure that as we come out of this crisis, and we'll be doing this, I think, right across all aspects of the economy and society, how we reflect on the lessons of the pandemic and make sure that we are learning the right lessons and also valuing, perhaps even more than before, those who have given so much and for whom to whom we now owe so much. Clearly, in the decisions that lie ahead of us, that will undoubtedly be reflected in pay negotiations. There will be a debate to be had, I think, over the next period about the structure of our social care system. But the most important thing right now is for us all to recognise the enormous debt of gratitude that we owe, and not to send signals, even inadvertently, that suggest that a portion of that workforce, because they have come here from other countries, are not as valued as others. And that, unfortunately, is the message that the UK government is risking in the decision they've taken around visas. Gordon Cree from STV.
Thank you. You've talked quite a lot in recent months about how pleased you've been at the way people have generally followed the rules. But in recent days, if you look at pictures of people in beer gardens or barbecues in gardens, or even just walking down the street, for a growing number of people, the 2-metre physical distancing seems to be a thing of the past. How concerned are you about that?
Right throughout this, I have been impressed with how people have complied with everything we're asking people to comply with. But I've also recognised that the things we're asking people to do don't come naturally. So there will be periods, and there will be at times some people who, not necessarily deliberately, but just find themselves maybe not complying as much as they should. And we will all find ourselves at times maybe just falling short of what we need to do. So that's why one of the reasons, it's not the only reason, I stand here every day and just remind people. As I said yesterday, I know you're probably getting sick hearing me do it, but just remind people of not just the measures we're asking people to comply with, but why we are doing it. So take 2 metres distancing. There are some circumstances in which, with other mitigations in place, we are allowing 1 metre distancing, but the general rule remains 2 metres. And one of the reasons for that, and it's one of the reasons we took quite a bit of time and took a lot of care over the decision to reduce to 1 metre in certain situations, is that we know we all overestimate distance. So, we might, and I find myself, pulling myself up about this at times, when you stand next to somebody, what you think is 2 metres might actually only be a metre or a metre and a half. So that was one of my concerns about reducing to a metre. If we reduce to a metre, then it becomes even less than that. So we have to think about all of this all of the time, and in a way that we're not used to, be very conscious of how we're behaving. So when we're in a shop, even although we've got a face covering on, just be mindful of how far apart you actually are from people, and just remind yourself all of the time. None of this is easy, and none of us find it easy. And I don't want to be the voice of doom standing here. I'm trying to be a balanced voice, but the voice of realism. The risk of this virus hasn't gone away, and as of tomorrow, that risk is probably greater than it has been for quite a while, because we will start interacting more indoors. And if we don't want to be, 3 weeks from now, where California is just now, of closing things down all over again, we have to comply with these things, all of us. So it's about thinking hard about every aspect of your behaviour when you're out of your own home and interacting with other people. And if we all do that, then we minimise those risks. And without overstating this, because it is true, every time one of us slips up on these things, either inadvertently or because we think, that's just not important, we give the virus a bridge to travel across. And if it gets across one bridge, then it will look for the next one to get across. And before we know it, it's out of control again. Think back to early March of how we went from the kind of figures I'm reporting now into something much, much bigger in what appeared like a very short space of time. I don't want to be standing here 3 weeks, 4 weeks, 5 weeks from now, finding that the numbers again have gone in the wrong direction. So please, please think about all of these things, and just be much more conscious of what you're doing when you're out and about. Alan Smith from Birr.
Thank you, First Minister. Radio Clyde is today hearing calls for the scientific evidence surrounding the reopening of schools to be published to provide that reassurance for parents and teachers. I know this is something that the Scottish Government has committed to, but can you give those parents and teachers a clearer idea of when they can expect to see this evidence, and can they expect any update on the plans for the reopening of schools before the 30th of July?
So we have, and I know you're aware of this, the expert advisory group that advises the Scottish Government. There is a subgroup of that, particularly looking at the education issues, and we have given a commitment, and it's a commitment I will repeat today, to publish the evidence of that group, and we will do that at the point that is possible to do. The Deputy First Minister will make a statement in Parliament next week, I think the 23rd of July, if I've got that date slightly wrong, forgive me. The Deputy First Minister is also likely to join me here at one of the daily updates later this week, not necessarily to talk only about schools, but to talk about some of the childcare issues as well. So we will give as much detail as early as possible and be very clear about the basis of the decisions we are taking as we take them. Becky Clark from Global.
Good afternoon, First Minister. Given that research shows that a second wave of the virus in winter could be even worse than the first, and the fact that we know that older members of our population living in care homes are the worst affected in some situations, will you consider locking down certain parts of society, such as care homes, to prevent the virus running out of control in these settings, as we have seen before?
Well, can I make just a few points about that? As I alluded to in my opening remarks, there's a report published today that is looking at the possible scale of a second wave and some of the actions that it is recommending governments take. And I think there's a couple of points worth making about that. Jeane and Fiona may want to add in terms of some of the planning we're doing. This report, as is often the case with reports of this nature, is a reasonable worst-case scenario. So the big numbers in it, of course, we can't exclude the possibility of those, but it is a reasonable worst-case scenario. And the second point would be that the planning that it recommends is planning that we are taking very seriously in the Scottish Government, and all of our focus should be on doing everything that we can to mitigate the impact of a second wave. And a point, I suppose, trying to link these points about a second wave to what I'm going to come on to reiterate. One of the things we need to do to get ourselves into the best possible position for dealing with a potential second wave later in the year is to deal as effectively as we can with the first wave, and to get the infection levels now to as low a level as we possibly can. And that's what we are seeking to do right now. And that brings me to reiterate the point again I made in my opening remarks. Our most immediate risk is not the autumn-winter second wave. That is a real risk that we are very alive to, but our most immediate risk is a resurgence of the first wave. What you're seeing in California right now, or in Melbourne, or in many other parts of the world, is not a second wave of this. It is that continuation of the first wave. And I come back to this, the way I find it easiest to understand. We talk about having locked ourselves down. We've actually locked the virus down and denied it ways of spreading. So took us a long time to do it and a very painful 4 months in doing it. But what we've done with lockdown is effectively stop it in its tracks, leave it with very few places to go. As we come out of lockdown, as we release ourselves from that, as I said earlier on, we release it from that as well. And so the real risk now is that the first wave takes off again. And that's our immediate priority, to stop that happening, which is important for its own sake, but it's also important in making sure that we don't go into the winter months with infection levels still at too high a point. So I hope that's reasonably easy for people to understand. Let's not take our eye off the ball of right now, even as we plan for what might happen later in the year. Jeane, do you want to say any more?
Thanks, First Minister. I'd say a couple of points, if I may. The first one is that planning for autumn and winter is well underway in the NHS in Scotland, and including discussions with our colleagues in social care. Our boards have been advised to hold a capacity to deal with an upsurge in COVID cases, both in beds and in ICU. We're also factoring into that the the infections and the viruses that come with winter, flu and other respiratory conditions. So we're looking there at how we can manage all of that if we have to, as well as trying, as I said earlier, to slowly and safely restart other NHS services that have been paused. But of course, it is the point here is that it is the balance of the two. We cannot assume that our NHS will not have to deal with significant increases in COVID-19 cases, or both in a hospital setting or in the primary and community care setting, where we have wrapped around our care homes that real clinical input so that we can be as confident as we can with our colleagues in social care that we are providing the right infection prevention and control advice. And of course, that all flows out into making sure that our modelling on PPE is as accurate as it can be, and that the orders are flowing in both for that, for other consumables, for medicines, and overall in workforce planning. But the core point is actually back to the point the First Minister made. While we do all that planning and it's underway and it's right that we do it, we will position ourselves best to deal with autumn and winter. The lower we can bring infection numbers down right now, so that we are as well placed as we can be to deal with what autumn and winter brings.
We saw in the response to COVID that our health and social care workforce was quite spectacular. And there's a lot of things we've learned from that, how we organise the COVID and non-COVID, how we created community hubs. So all of these components are still in place and they will continue to be there. And the education, so looking at capacity. Boards are currently looking at how they recruit the new graduates who are qualifying over the summer across all professions, all disciplines, to make sure the rehabilitation from COVID, as well as any second wave, might come in. So there's a lot of preparedness going on just now to both remobilise, but look at how we do that. And one key thing, the Cabinet Secretary has mentioned flu. Once we look at the flu immunisation programme, we will be encouraging everyone who's eligible within the community to take the flu immunisation. But I think, as importantly, all health and social care staff, we will be encouraging to uptake that flu vaccination, which we offer every year, but we would expect that to be a much higher uptake this year so that we can keep our health and social care staff healthy and well.
Jeane Bussey from PA.
Good afternoon, First Minister. I wanted to go back to the issue of care homes, if I may. You mentioned yesterday an outbreak in a care home in the Greater Glasgow area, and I just wondered if there was any update on that, including any information perhaps on how the virus may have got into the home. But also, secondly, if I could to ask about the UK government immigration proposals. Donald McCaskill of Scottish Care has described these as a slap in the face to care home workers. Do you agree with that? Have you spoken to him about his concerns? And what can you do or the Scottish Government do to try and halt these changes? Is it something you'd raise with the PM or the Home Secretary?
Thanks, Katrine. On the care homes point, I'm not able to give a more substantive update on the care home that I mentioned yesterday. The incident management team, I understand, is meeting again this morning to look at the circumstances of that. What I can say, and please take that this is provisional information right now, so it is subject to change, but today's 3 cases, we know at this stage are one in Lanarkshire, one in Ayrshire and Arran and one in Grampian. And at this stage, and that's the point I want to stress, at this stage we have no information to suggest that any of today's 3 cases are linked to previous cases, and that includes no information to suggest that they're linked to the care home in Glasgow that I spoke about yesterday. So as you will appreciate, these things are looked at very closely, and these things are always subject to change as those investigations proceed, but that is the provisional information I have at the moment. In terms of the point about immigration, I suppose I'll repeat and try to do it quite briefly the points I made to Glenn Campbell of the BBC. I do think that excluding social care workers from the ability to apply for a health and care visa to come and work here is sending the wrong message, and is sending a message that we don't hugely appreciate. The the work of those staff at all times, but including over the past 4 months. Donald McCaskill did say it was a slap in the face. That is his terminology, but I don't think he's wrong. That is the message it risks sending, and I would hope that the UK government, who I am sure would not want to send that message, I hope they will reflect on the risk that they are running there. I have had discussions with a range of different sectors, including Scottish Care pre-pandemic, about the risk to social care and indeed other sectors of the kind of restrictive immigration system that the UK government wants to introduce post-Brexit. The Health Secretary may want to say more because she's having regular discussions with Donald McCaskill right now about a range of pandemic-related things. But again, this is an issue that we have raised repeatedly with the UK government and will continue to raise repeatedly. The immigration approach that they're taking, particularly, I think, around social care for the purposes of this answer, risk doing huge practical damage to our economy and huge practical damage to sections of our society like social care. But they also risk sending a message that I never want to be sent from Scotland, is that we somehow don't want people to come, once we're out of this pandemic, from other countries to live and settle here and make a contribution, or that somehow we don't value the contribution that they make, because nothing could be further from the truth. We're all living under restrictions none of us relish at the moment, but that doesn't change the fact that Scotland is an open, welcoming country, and I think the vast majority of people would want us always to be so, and never want to see a message sent from the UK government that contradicts that in any way.
I would add a couple of things to that, if I may. One of the earlier questions asked quite rightly about what we were doing as we look ahead about how we can ensure that working in social care is a valued job. And obviously that relates in part to the terms and conditions that people work under, but it also relates to the culture that they are part of and the value that is demonstrated to them about the importance of the job they do, a really important, vital job, as anyone knows who has a relative or a loved one in receipt of social care. What I would say at this point, and I would share this with Donald McCaskill, is the current message that is being sent is one that undervalues that profession. And I think that is both practically difficult, but as importantly, incredibly difficult then if we want to really work out in practical terms what more we need to do to value that workforce, the current workforce, as well as those that we would hope would come and join us because they want to undertake that work and they want to live in Scotland.
Thank you. Rachel Watson from the Daily Mail.
First Minister, there are comments today from a Scottish clothing company. They've raised concerns about what they describe as anti-English rhetoric caused by protests on the borders and concerns around quarantine for visitors. They've said that they fear this will impact their business because it might put people off visiting from England. What would you say to businesses that are concerned about this? And also, what would you say to people from England who are looking to visit Scotland? Obviously, schools in England go back a little bit later than those in Scotland. Would you encourage people to come up and visit Scotland to help the tourism sector?
I've not seen the comments that you refer to, so I won't make my remarks particular to those, but there's not an anti-English bone in my body. I don't have a single anti-English fibre of my being. I come from partly English stock. My grandmother was English, so and I lead a party that is full of English people, so there is nothing about this. We're dealing with a public health crisis right now, and I think anybody who tries to say that the decisions we are taking in a public health sense are somehow political, constitutional, or suggest in any way an attitude towards people from other parts of the UK are just plain wrong. And I would ask people to think carefully about any suggestion of that type. You've heard me say before that there are many, many parts of the world right now where particular parts of countries have internal borders closed to other parts of countries because of a desire to stop this virus spreading. And I think some public health experts from overseas probably look at this debate in the UK right now askance and don't really understand why we wouldn't be driven purely by considerations of public health. And I'm going to try to be driven purely by considerations of public health. And what I'd say to to businesses is the worst thing I can do for any business right now is to stop being cautious about the control of this virus. Because if we do stop being cautious, we risk, again, as we see in other parts of the country, a further shutdown of parts of the economy, up to and including a potential second lockdown. And that will be even more devastating, with potentially even more and even longer term damage to the economy. So no business should be wanting me to drop that cautious approach, because it is in all of our interests, however difficult it is right now for businesses, and I don't underestimate that. But if we don't build a sustainable recovery, then we don't have a recovery at all, because we will end up going backwards. And in terms of our tourism sector opens tomorrow, I want people to be able to enjoy our country. In fact, you know, as I've said a few times standing here before, if you are a Scottish person living in Scotland, a Scottish resident, then take the opportunity to have a holiday, if you're able to have a holiday at all. Take it in Scotland and help our tourist industry. And to people coming from outside Scotland, we continue to be very careful and very vigilant about infection rates elsewhere in the world and elsewhere within the UK, and talk to counterparts in the UK about all of these things. But anybody, whether you are visiting Scotland or living here, the most important thing I can say to you is follow rigorously and rigidly all of the public health advice. When you're in Scotland, it's the public health advice here that applies. So facts, that's my message to everybody. Face coverings, avoid crowded places, clean your hands in hard surfaces, 2 metres distancing. And even if you are only visiting Scotland, if you have symptoms while you are here, book a test through Test and Protect. And that is a message that I give to people visiting just as loudly and clearly as I give to people who live here. Scott McNabb from the Scotsman.
Thank you, First Minister. You've described the changes coming in tomorrow as the highest risk since we've come out of lockdown, with pubs, hotels and all the indoor spaces returning. Today we have the Tories launching a campaign to get Scots back into pubs. It's been echoed by the drinks industry, as you may imagine. But given the comments you've been making about, for example, if you're not prepared to give your details, don't bother going, would you be apprehensive about a national campaign of that kind to get Scots back into pubs, hotels, etc.?
Look, we're opening indoor hospitality just as we're opening tourism, because we've suppressed this virus to very low levels, but we know there's still a risk. But we also know that the harms of lockdown are such that we can't stay in lockdown forever. So these are a set of balanced decisions, none of them risk-free. And of course, we want people to support businesses, whether that is your local shops. And I would say to people, shop locally if you can just now. I say to people, as I just have said to people in Scotland, try to holiday if you're able to holiday at all in Scotland to help our tourist industry. And if you're going to a pub to support our hospitality trade, then do so carefully. I can't, and I'm not going to stand here and just say all one thing or all the other, because that's, I'm afraid, it's just not the reality of life. We're trying to navigate our way through a really treacherous situation here as carefully and as safely as possible. So yeah, I'd love to be at the stage where I could just say to people, you know, crowd into the pubs and don't worry about it. I'm not going to say that, because I can't say that, and I wouldn't be doing the hospitality industry any favours. They'd all be closed down again sooner than we knew where we were. So what I'm saying to people is enjoy these freedoms that have been hard won over the past 4 months, but do it carefully. And if you're not prepared to abide by the public health advice about how we do it carefully, then stay away, because you're putting others at risk. And I'm afraid, given what we're dealing with just now, that includes putting people's lives potentially at risk. On the other hand, if we all abide by this, then I hope that we can open up all of these things, but without the risk of the virus spreading again. This is down to all of us. It's not just me that can determine what happens over the next few weeks. I'm relying on, obviously, we've got the ultimate responsibility in government, and for me, rests on my shoulders. But I need to have everybody out there doing what we're asking, because otherwise we won't keep it under control. And if you doubt any of this, as I say, just look at all of the state of California, which, you know, is a big place, bigger than Scotland, and statewide. Last night, the governor of California has just shut down pubs, restaurants, cinemas, museums, all the things that are about to open in Scotland tomorrow. So if we don't want a few weeks from now to be in that position, then all of us have to do the right thing. And I'd say to everybody of whatever political stripe, just be cautious and sensible about this. I know that I'm having to take decisions here and the Scottish Government is having to take decisions that are not always popular. We're restricting how you live your lives, for goodness sake. That's not popular, but we're not doing any of these things lightly. You know, just like face coverings, when, you know, some people thought maybe we shouldn't mandate face coverings, but we're doing these things because they help. None of them are magic wands and will stop this virus in its track all by themselves. But if we all comply with all of them, then we've got the best possible chance of keeping it under control. So please don't just think pubs are open, so it's fair game to go and behave as we would previously have behaved in pubs, which hopefully for the majority is well and responsibly. We've got to follow this advice unless we want to go backwards again. And I don't think any of us want to go backwards again. Christine Lavelle from The Sun.
Thank you, First Minister. It was just a couple of questions regarding the reopening of schools in 4 weeks' time. I just wondered, will pupils be expected to wear face coverings and physically distance on school buses, or will those be treated as part of the school estate and therefore the rules won't apply? And also, will there be proactive testing of teachers and older pupils when schools reopen?
Well, these are all things that are being considered right now. I'm not going to give definitive rulings on these things until we've done that proper consideration. As I said a moment ago, the Deputy First Minister, who's also, as you know, the Education Secretary, will make a statement to Parliament next week, and he'll join me here later this week, I think on Thursday, at the daily briefing, where he'll be able to give his up-to-date thinking on all of these issues. He convenes the Education Recovery Group, which is looking at all different aspects, advised by the subgroup of our expert advisory group. Alistair Grant from the Herald.
Hi there, thanks very much. You mentioned obviously the steps just taken in California, including closing indoor areas and bars and restaurants. Is there a level of new infections after which we'd have to take similar steps here? For example, a rise in the R number or a certain level of local outbreaks? Can that kind of thing be quantified before it happens, in a sense?
I'm not going to give set numbers because it's not quite that straightforward. But we look at all of these things very carefully. It will be a combination of... One thing I would say as a preface to my remarks here is, as we get to a lower and lower level, the R number that we have talked about so often for good reason actually becomes a less reliable measure of what the infection is doing, because very, very small changes in the number of cases can then have a disproportionate impact on the R number. So I'm not saying it's not important at all, but it is, given the level that we're at now, it's not the most reliable factor. So we will look carefully at cases. You can see that over the last few days, where increases in cases have led us to very carefully examine what lies behind them. So it will partly be direction of travel. Are things going up again? Are we seeing a growth in community transmission? It will also be, are there connections, as it suggests, actual community transmission, or are there particular localised circumstances? For example, as I covered yesterday, a big portion of Sunday's rise in cases was down to a single care home. So we will take all of these factors into account and come to balanced decisions. We want to avoid, if we possibly can, going into further lockdowns, certainly further blanket lockdowns, but we may have to take targeted, localised decisions to try to constrain any further spread. And one thing I would say, and I've said it before, but it's worth me repeating it, I won't take any of these decisions lightly, and the Scottish Government will not take a single one of these decisions lightly, but we won't shy away from doing what has to be done. I don't want to see this virus take off again, because I know the toll that takes on lives and on health and on the economy. So we will take whatever action is required. And if we are in a position of having to impose any restrictions again, as was the case a couple of weeks ago in Dumfries and Galloway, we will set out exactly what is driving those decisions, what the basis of the decisions are, and how we intend to move beyond that. Daniel Sanderson from The Telegraph.
Thank you very much, First Minister. As you said at the start, it's been nearly a week now since we last saw a coronavirus death in Scotland. In the most recent 6 days for which we have figures, in the UK there have been 439 deaths, and in England alone, nearly 2,500 confirmed cases. Now, if this disparity continues, given what you've said about being driven by public health, is it inevitable that you will impose quarantine restrictions on people coming to Scotland from other parts of the UK?
I can see the headline you're trying to write tomorrow with the invitation to use the word inevitable. So if you don't mind, Dan, I'm going to maybe just avoid falling into that carefully laid trap for me. Nothing in life is inevitable, except that if we don't all take care over this virus, it will start to spread again. That's inevitable because that's how virus works. But beyond that, I will take, as First Minister of the Scottish Government, we will take careful decisions based on evidence and judgment and the precautionary principle. And I hope we don't have to do any of that, but I'm not going to shy away from it if it is what is required to try to stop this virus taking any more lives and doing any more damage than it already has. Kieran Andrews from The Times.
Thanks, First Minister. Last month, Social Work Scotland said in an open letter to the government that a heavy-handed and paternalistic approach from central government and public health towards the care home sector had undermined the morale of staff. What would you say to Social Work Scotland, and what impact do you think that has on attempts to attract and retain people in the sector?
I will make sure I go and read that letter. I'm not sure I have seen it in full, so I would want to see the context of that, and I certainly don't mean any criticism of Social Work Scotland in what I'm about to say, but I refute the suggestion that there's been a paternalistic, heavy-handed attitude. We've tried to take the right decisions based on the evidence we had at the time to protect care homes and those in care homes as much as possible. And, there have been many occasions where I've stood here and had questions sort of put to me with quotes to suggest the opposite, that we haven't been careful enough in the action we've taken in care homes. So, we've tried to do the right things, and inevitably we won't always have got that right, and inevitably as our knowledge of the virus has changed, we will have changed our policy and approach. But I don't accept that characterisation, but I will want to go and read the full comments to make sure I understand the context, because it is perfectly possible, if not likely, that there are plenty valid comments made in the letter that we'll want to respond properly to. Tom Martin from The Express.
Hi, thank you. Just very briefly, you've covered it quite extensively already around this issue of compliance with reopening of hospitality. But just very quickly, are you concerned about any potential flashpoints around people, given alcohol may be involved and not willing to cooperate with staff when they're trying to get on with their jobs?
I wouldn't describe a concern about flashpoints. I mean, I remember saying at an earlier stage of this, I wanted to treat people like grown-ups. So maybe this is a point where I should do it. I think we all know that in particular places, and this is not a reflection on the hospitality trade or industry at all, but we all know in pubs where alcohol has been taken, sometimes our inhibitions are lowered, and not even deliberately, but we find ourselves behaving in a way that we wouldn't otherwise do. So getting closer to people than we would know is sensible, perhaps. So we just have to think much more carefully now. None of us enjoy this. We're in the summer. We all would love to be, going about our lives normally, in the days when the sun shines, sitting in beer gardens or enjoying everything that the summer brings. But we can't do that in the same way as we would normally this summer, because we've got a deadly virus stalking us. So we've just got to be really careful and be on our guard, when we might have had some alcohol, maybe even more so when we've had some alcohol than we would be otherwise. I don't want to be the big wet blanket, there's a headline that I've written for somebody for tomorrow, on people's summer enjoyment, but much more the case, I don't want to be standing here in a month's time reading out horrific figures again on ICU cases and hospital admissions and deaths. And if we're not all really careful right now, that's exactly what I will be doing. So I'm sorry to be that, what I said I was a moment ago, but it's in everybody's interest that we just all keep the heat around this and do the right things. So I think I know what the Daily Express front page is describing me as tomorrow. Vivian Aitken from the Daily Record.
Good afternoon, First Minister. I know you said earlier that you couldn't give us any more details on the care home problem from yesterday, but could you tell us at least where this care home is? I know when we had the cluster in Dumfries, you were able to set out several towns that were being looked at. Could you tell us where the care home actually is? And also on the term of face coverings, while there seems to have been great compliance in shops, can you tell me how it's going to be policed on public transport? Because I heard at the weekend from several friends of mine who were travelling that people were wearing the face masks to get on the train, but the minute they get on the train, they take them off so they can have a chat. With a 1 metre distance on public transport now, does that concern you?
Okay, on the care homes, I appreciate the attempt when I say I can't give you any more details to say, but please just give me this detail. I can't give any more details on it. If, as was the case in Dumfries and Galloway, we at any point thought there was a wider risk of transmission from any group of cases, then we would say all of the things that we require to say. But this is still under investigation. I think people should perhaps not overly, but take a little bit of assurance from the fact that, as far as we know right now, none of the cases today are associated with the care home. It's in the Greater Glasgow and Clyde Health Board area, and if more information is required to be put in the public domain for the purposes of stopping any further transmission, then the public health experts who, through the incident management team that are managing this, will do that. And that, I think, is the key thing to say. On the point about face coverings, you know, the question, how will this be policed, I think is maybe not the best way of looking at it. I used the analogy last week a couple of times of seatbelts. We don't police the wearing of seatbelts in the sense that a police officer checks you every time you get into your car. If they catch you not wearing a seatbelt, they will impose the penalty on you and take the appropriate action. But we all wear, or at least, you know, I think most of us wear seatbelts, not because we're worried about getting caught by the police for not doing it. We wear seatbelts because we know it's important to protect ourselves in case the car crashes. So that's really what we have to be saying to people. If you are in a shop or on public transport, bus, train, whatever, and the police see you not wearing a face covering, I'm sure the first thing they will do is tell you that you should be and give you the chance to rectify that. But if you don't do it, then they will have the option, and with their operational independence, of course, of imposing the fixed penalty notice on you. But don't put the police in that position. The police have got better things to do than tell you to wear a face covering when you know you should be doing it for your own protection. So we all, how is this best policed? By ourselves, because we know it's the right thing to do for the protection of each other. As Fiona was saying earlier on, wearing a face covering protects other people, and other people wearing a face covering protects you, and that's why we should do it. And yeah, if you get caught, you'll potentially get a fine, but don't get caught because don't put yourself in the position of not doing what the law and common sense tells you should be doing. Paul Mallock from the Courier.
Good afternoon, First Minister. Would the Scottish Government consider immigration campaigns in England, Wales and Northern Ireland to encourage people from the rest of the UK to come and live and work in Scotland, in particular our health and social care sectors? And with that in mind, could the Scottish Government not sort of set the lead example by sort of incentivising work in health and social care and treating it as the profession as it really should be treated?
Well, we will certainly do everything we can to treat it as a profession. It should, as a profession, in the way it should be treated and valued as such. I don't think campaigns like that, where we're dealing with a pandemic, would necessarily be something we do. And I'll be corrected if I'm wrong here, but I think in the past we have done advertising campaigns in London, for example, encouraging people perhaps to think about the quality of life in Scotland if they're thinking about changing job or relocating. So, yeah, we would always, in other parts of the UK and in other parts of the world, take great pains to illustrate and persuade people of all of the many, 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 many great things about living and working in Scotland. But of course, while this pandemic is something we're dealing with, then, you know, obviously our key thing is about trying to keep the virus under control. But as I said in response to a question earlier, Scotland's an open, welcoming country. We have a real need to encourage people to come and live here. So once we're out of this pandemic, hopefully in the not too dim and distant future, then we'll get back to the job of encouraging as many people as possible to come to live in Scotland, work in Scotland, study in Scotland and visit Scotland, because it's a great place to be. And lastly today, Terry Murden from Daily Business.
Good afternoon. You've asked for more financial powers to enable you to deliver a tailored response for Scotland's economy. Alison Thewlis has repeated that message again today. Could you give a bit more detail about what you mean by tailored response and what it would look like? I'm just wondering if Boris Johnson, in a fit of pique, gave you the powers to raise more money for the economy, how would you spend it? What would your priorities be?
I'm not sure fit of pique would be the way to describe it. If he did decide to accede to the request for more powers, possibly an outbreak of common sense would be the better way to describe it. He hasn't done that yet, and we will continue to make that very rational case. We're not the only ones making it. You know, think tanks have made that case, others have made that case, and our priorities in spending any additional borrowing power we had, or flexibilities within our budget to switch resources from revenue to capital, for example, would be to give an additional economic stimulus over and above that which the UK government has already announced. So that would be on capital projects, and we would set out the detail of that if and when we are in that position. But I think the most important thing right now is to continue to make the case for it and to gather as much support behind that argument as we can. That concludes the questions for today. My thanks to all of the journalists for joining us, to Jeane and Fiona and Anna, who is our BSL interpreter for today, and thank you to all of you for joining us. As I said earlier on, tomorrow is the biggest step we've taken out of lockdown so far, and it's hard earned, so enjoy the additional freedoms that is giving all of us, but please do so safely and responsibly. We don't have to look very far to see that this virus is still there and it is still capable of doing a lot of damage. So as we go out and about a bit more, as we meet each other indoors, this is even more the case. It is more incumbent on all of us in our individual behaviour to stop the chains of transmission, of not allowing the virus, the bridges, to travel across. And that means the facts are what everybody should be abiding by. Face coverings, avoiding crowded places, cleaning hands and surfaces, 2 metres distancing, and self-isolating and getting a test if you have symptoms. All of these steps now are more important, not less important than they have ever been. So please, I appeal to everybody to make sure you stick rigidly to all of that advice. Thank you very much for joining us today, and I will see you here tomorrow at 12:30 as usual.